Here?
Bybee,
Here.
Dare,
Here.
City Attorney Adams. City Manager Croots.
Here.
We have a quorum, thank you.
Okay, just for the record, Councilman Abbott is on the phone because he may have COVID, he may not. We don't know until he gets his test back. So in an abundance of caution, he's attending via telephone today. Okay, opening ceremonies. The invocation is Pastor Jose Rodriguez.
Good afternoon. Pleasure to meet all of you today. If you would close your eyes with me. Mighty and sovereign God, we thank you once again for the opportunity just to have life. Thank you for this gathering here today as we pray that you would lead and direct our city officials and our city leaders, God, to use wisdom, Lord God, to activate discernment, and above all, Lord God, to glorify and honor you in our land once again. We ask, oh God, for your wisdom, for your direction, and that we would be able to speak to one another with love and with kindness and with understanding, Lord God. And we know, my God, that we can reach some level of agreement. So we ask that you would be glorified. Keep all of them safe, families safe, protect them, God, and deliver them from harm. We pray all this, Lord God, believing that you're going to have your way. In Jesus' name we pray, amen.
Amen. We remain standing for the Pledge of Allegiance. Councilman Dare, will you lead us?
Sure. You ready, everybody? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Moving on to item 4, public comment. Our first speaker is Damon Harrell. Come right up here, sir, and you can have a seat. The mic is on for you.
Absolutely. Mr. Maber, council members, everyone, thank you for the time to speak to you. A little bit about myself. I'm a former Marine. I've been resident of Sparks for nearly 14 years. I have a wife who works for the school district, 2 adopted sons, 10 and 14. They both attend public school. I will be addressing the government's or the president's executive order regarding vaccinations. So I first want to inform you that my wife and I have both chose to get vaccinated. I'm approaching 50. I have high blood pressure and I'm considered obese. My wife is also 50 and a cancer survivor. We checked the boxes. Let's say we need more protection than the average citizen. On Thursday, September 9th, 2 days before the anniversary of the greatest attack on our freedom, the President of the United States went live to tell Americans it's not about freedom. I beg to differ. It's always about freedom. It's always about our rights, immunities, and privileges as sovereign individuals. And I believe that the first responsibility of all levers of government is to protect those items. While vaccination was the correct choice for my wife and I, it's not the choice for everyone. We left the vaccination choice up to our oldest son. We provided the pros and cons and let him choose. He decided not to get vaccinated at that time. As a parent, I agree with this decision. He is literally 50% less likely to die of COVID than influenza in any given year. And recently, there's at least one research paper that shows that children do not spread to their caregivers. I implore you to craft a city ordinance that does not allow any entity to require the vaccination of our youth for COVID-19 or to participate in any activity or attend public places, including school. Besides the cited research that children don't spread to caregivers, there's also new research that indicates that children are more likely to suffer from heart inflammation due to the vaccines. For males between the ages of 12 and 17, the expected number of cases following dose 1 using a 21-day window is 2 to 21. That's nearly 10% that suffer from heart inflammation. And I have a 14-year-old student athlete. We were asked to flatten the curve. We did that. While we're being told to flatten the curve to help protect our healthcare system, the federal government, and in some cases, healthcare systems themselves, are working against their own good by putting vaccine mandates on their employees. Those individuals that, for those that need to protect themselves, there is a vaccine. Those individuals that choose to wear masks can wear them forever if they'd like. But government's job is not to protect people from themselves. Government's job is to protect the right of people to choose to make their own choices. Do I suggest that everyone over 50 or in any high-risk group get vaccinated? Absolutely. But I'm responsible for me and my children, not you, and certainly not any petty tyrants named Sisolak or Biden. I insist this council write a city ordinance protecting the freedom of medical choice for the citizens of Sparks.
Thank you, sir.
Thank you.
Okay, next speaker is Bob Boston.
Okay, I'm here for one reason. I got this warning notice about my vehicle. Parked on the street for over 48 hours. I thought, well, that's pretty good. I parked there for 2 years, right? And the other neighbors in my neighborhood been parking there for 2 or 3 years too. So I thought I'd be a smart butt. I called to get them to do some action. City to do action about vehicles on the street with no license plates, on jacks, no parking for the people that live there, right? Well, I called, they came and did it. I thought, oh, that's pretty good. All of a sudden, all the cars moved. Well, the cars that were moved didn't have no licenses. So that constitutes driving on a public thoroughfare, according to the codes. So I called Sparks PD. I got the usual runaround. The best one I got from the desk officer or whatever, called the governor about the unlicensed stuff. We're in a moratorium. Okay, so then I got really irritated. And I did some research. Municipal codes, they cover unlicensed vehicles on a public street. They cover unlicensed vehicles in their driveways. Okay? And I did the Nevada, it covers it. The same as Sparks does. Okay? Did Washoe County, they cover a difference. Those vehicles in the driveway without any license plates on and messed up, wrecked or whatever, those are called nuisances. I thought, what's a nuisance? Oh, wait a minute. The guy across the street that got the same moving in 48 hours, he moved it to the driveway. They said, October 1st, they're gonna send a tow truck in there and tow everybody off. Well, I didn't see no tow truck. I've lived there 45 years on Wednesday. They're all back on the streets today, but one of them's parked up on the lawn. Okay? And I've lived there 45 years. In the last 10 years, I'd say. You know how many cops I've seen in my neighborhood? 2. One of them was a personal friend of mine. Talked to one officer, oh yeah, we did it, 3 o'clock in the morning, right? The only time we see people on our side of town with the badge is when somebody gets killed or somebody gets attempted rape, right? We live on this side of town. We don't get the same protection as those people over here. And if you excuse me for 1 second more, I'm going to do this. If we got 7 officers on duty right now today, as we're in this room, okay, where are they? Who are they protecting? What kind of work are they doing? That's what I'm upset at. Tell me, 7, if you enforce these laws, you could get the money from the state that they charge for taxes and pay Washoe County 22%. You should be getting 7% of it. Thank you.
Thank you, Mr. Boston. Okay, anybody else wishing to speak in public comment at this time? Seeing none, we're gonna come back from public comment and look to the approval of the agenda. Ms. Spivey.
Thank you, Mayor. I'd like to move to approve the agenda with one change. I'd like to move item 9.6 after item 6.1.
Okay. I'm looking for a second. Second by Mr. Anderson.
I will second.
Thank you. And all those in favor, please vote. Mr. Abbott? Aye. And motion carries unanimously. Thank you very much. All right, looking for consideration possible approval of the minutes of Spark City Council meeting for August 23rd, 2021. Looking for a Mr. Dare.
I move to approve the minutes of the Spark City Council meeting for August 23rd, 2021. Thank you.
Ms. Vanderwell?
Second.
Okay, got a motion and a second. Any other discussion? Seeing none, please vote. Motion carries unanimously. Okay, that brings us to item 9.6. Consideration, discussion, and possible approval of a payment to Renown Health Foundation in the amount of $430,565 to the City of Sparks share the regional expenses related to the expansion of hospital capacity in response to COVID-19. Mr. Kronk.
Good afternoon, Mayor, members of the council. I'm before you today, my name is Jeff Kronk, Chief Financial Officer for the record. I'm before you today with a request to approve a payment to Renown Health Foundation for $430,565, which would represent our portion of expenses that are related to their expansion of capacity in relation to the COVID-19 pandemic. If you recall, when the pandemic first started in March of 2020, we entered into an agreement with City of Reno and Washoe County to split costs for certain regional-wide efforts in response to the pandemic as it approached. Subsequent to that, Renown approached us with a desire to seeking assistance in funding for a project that cost a little bit under $2.9 million, again, to expand their capacity, if you will, to handle the surge in patients that they were experiencing, especially last fall. Our portion of that under the agreement, the split, if you will, between the various entities would be, our portion would be 15%, Reno would pay 35%, and Washoe would pay 50%, 50. That's true for all similar, regional expenses, or regional efforts. So our portion that represents 15% of that is the $430,565 of that roughly $2.9 million project. Specifically, the amount that we would be spending would be used to reimburse the hospital for 255 pieces of equipment that are used for remote patient monitoring that essentially help them to free up hospital beds. So this is equipment and related software and services designed to do that. So just to cover the financial piece of it, this isn't a budgeted expenditure that we came into this fiscal year with. However, we kind of knew it was out there, but we didn't know timing and the amounts and all that, so we did not include it. However, we're recommending that this be spent out of the general fund, but we'll have to come back to you at a later date with an augmentation of that general fund, and we're looking to use the America Rescue Plan Act, the ARPA funds, and use that directly. So this isn't an example where we would spend the funds directly and report it directly to the feds. This would be used indirectly, as we've talked about before, and utilize our resources that are generated from the lost revenue provisions that are allowed to us through the ARPA Act. With us today is Dr. Tony Slonim. He was very gracious in offering up his time. So that's all the presentation I had for you today. So with that, he's available to answer any of your questions, or am I?
Dr. Slonim, do you have anything you want to add?
Mayor, council members, thank you. Dr. Anthony Sloan, for the record, President and CEO of Renown Health. Thank you all for inviting me today. It's a great honor to be here. And we are certainly appreciative of the work behind the scenes to help us continue to advance innovative methods for enhancing hospital capacity in our community, particularly as we continue to surge with this terrible pandemic. The activities that you guys are working on funding or have funded for us relates to the ability to move patients to alternate settings outside of the hospital. Those patients who may be a lower acuity, who may only need oxygen and some central monitoring, that's the group of patients that this will enhance and free up those valuable hospital beds for those who are in worse need of them, such as those who require ventilation with a machine or other services that we can only provide on the inpatient setting. So I thank you for your consideration. As was mentioned, this is a jurisdictional approach with the county and the city of Reno, and both of those jurisdictions have approved the motion, so we appreciate your indulgence.
Okay, question from the council, Ms. Bybee.
Thank you, Mr. Mayor. Thank you, Doctor. Welcome
Thank you.
to the City of Sparks. My question on the, so this is for the remote patient monitoring. These, my understanding, I'm reading, our brief on this. This equipment was already purchased. It's not something, it's not additional equipment that you need now as we look at the capacity issues with the COVID right now.
Correct.
COVID and it's not just COVID. I mean, I was at the hospital with my dad, your hospital, a couple of weeks ago, and I know it's a lot of other issues, but I guess I'm trying to, is it for, that's already been spent and already added to your capacity, and do you think that more will be needed to continue this program because you're able to free up hospital beds? I mean, it makes sense that the expenditure, but I'm trying to kind of get timing, and are we looking at more if you continue to have capacity issues?
Thank you so much, and it's a great question. We have, just to set context, the initiation of this approach started way back last August and September when we were in dire straits in the community. Given where we are now, a year later, we are significantly better off and still have 70% or so of the community has been vaccinated. We now know we don't need the alternate care site as we stood up at the time when we were facing a crisis. At that time, we were getting help from around the country for people and providers to come into town that we no longer need. So I think that we are certainly in a different place from a macro perspective than we were. But the most important part is, again, to the question, these monies have been spent as a way of helping to assure that if the surge occurred, we can use these tools and technologies to monitor people from home without admitting to them a hospital, thereby freeing up those beds for people with other conditions as well as COVID, heart attacks, lung problems, trauma, or even kids. As we know, kids are not vaccinated, and we're seeing an increased surge of them in our community for hospitalization.
Mr. Dare.
Yes, I also just want to say thank you. Thank you for your leadership in our region, and it's what an incredible time to go through, and you guys stepped up and were really nimble trying to figure out what to do, so it's an honor to support those things. We've heard that a lot of our hospitals are seeing some capacity issues now again. Do you just mind, I know it has to do with this, but can you just speak to that for a moment as we, it's almost a similar question to what Councilwoman Bybee asked, but could that look like? What are we anticipating here?
Yeah, so we currently at Renown Health, as of this morning, have 103 hospitalized patients with COVID from our community. Other hospitals are also struggling. We're all at capacity issues as it relates to that, and we're doing the best we can, not only to make sure that we're caring for people by building additional virtual capacity, a la the assignment that we're talking about today, but also to make sure that we're using those beds in as an appropriate manner as possible. So far, again, at the very highest levels, we're in a much better place than we were a year ago. So we always have to keep that context in perspective. Thank God we are further along. We've got people vaccinated. The people that we're seeing being admitted to the hospital are primarily not vaccinated. And it doesn't mean that for them it makes the condition any less severe. But we also want to make sure that we're doing what we can to make sure they have the care that they need and free up capacity and be innovative. There's a segment of them who may not be as severe and could be handled with this technology at home, and that's why we wanted to invest early so we could use it over and over again until we get out of this bloody mess with the pandemic.
Okay, any other questions from the council? Not, I'm looking for a motion. Ms. Bybee.
Thank you, Mr. Mayor. I move to approve a payment of $430,565 to Renown Health Foundation, representing the City of Sparks' portion of a regionally shared expenditures related to the expansion of hospital services capacity in response to the COVID-19 patient surge.
Ms. Vanderwell.
Second.
Okay, I got a motion and a second. Any further discussion? Seeing none, please vote. Aye. Motion carries unanimously. Thank you, Dr. Sloan, and thanks for your
Thank you
time.
all.
All right, we'll move back to item 7, announcements, presentation, recognition items, and items of special interest. 7.1, boards and commissions, vacancy announcement, Sparks Parks and Rec Commission. Mr. Kreutz.
Good afternoon, Mayor Lawson and members of the City Council. For the record, Neil Kreutzer, City Manager. We have a single vacancy for a partial term that will run through June 30th of 2022 for the Sparks Parks and Recreation Commission. In order to be able to apply for that position, you will need to either be a resident of the City of Sparks or hold a valid Sparks business license. Applications for the vacancy will be accepted until October 1st at 5 p.m. Applications are most easily found on the city's website at www.cityofsparks.us/getinvolved. And it's one big word. Once you're there, click on volunteering for a Sparks board, commission, or committee. Fill out the application form and press submit. Thank you, Mayor Lawson.
Thank you. Item 7.2, proclamation Hunger Action Month. Is there anybody here to receive this proclamation? Come on down, have a seat. Councilman Dare is going to read the proclamation, and then we'll have you speak after.
Wonderful. Welcome, Shane. Good to have you here. Thank you. Whereas hunger and poverty are issues of serious concern in the United States, the state of Nevada, and the city of Sparks, and whereas raising awareness about the need to combat hunger in every part of the community is an essential first step toward providing additional resources that residents in the city of Sparks need to recover from the economic damage caused by COVID-19. And whereas the city of Sparks is committed to working with the Food Bank of Northern Nevada and educating people about the role and importance of food banks in addressing hunger and the need to devote more resources and attention to hunger issues, and whereas more than 10,802 individuals in the city of Sparks relied on food provided by the Food Bank of Northern Nevada in 2020, and whereas the Food Bank of Northern Nevada distributed more than 1.2 million pounds of food in 2020 through its network of food pantries, partner agency, kids cafe sites, and other community organizations within the city of Sparks, and whereas food banks across the country, including the Food Bank of Northern Nevada, will host events throughout the month of September to bring awareness and attention to encourage involvement in efforts to end hunger in their local community. Now, therefore, Ed Lawson, Mayor of the City of Sparks of Nevada, does hereby proclaim September 2021 as Hunger Action Month. Yay! Good job.
Thank you.
Give us your name for the record and
Sure. My name is Shane Piccinini. I am the Policy Director for the Food Bank of Northern Nevada. And first of all, I want to say thank you to the council and to the city of Sparks for the support that they have given us over what has been, without a doubt, one of the most challenging periods that we have seen, probably, in a long time. There was a financial crisis back in 2008, as you may recall, and this has certainly swamped the response that we had for that. And the response that we are providing continues because the need, quite honestly, just is not going away. There's a whole bunch of, external reasons for that related to housing and access to healthcare and other things, but if it was not, well, thank you. Because of the support that you have provided us, we literally have saved people's lives over the last 18 months, and that is not a small thing. And we are incredibly grateful and appreciative and thankful for the cooperation and the willingness to work with us that has been provided by the council.
Thank you. Councilman Dare.
Yes, one of the questions before we take our glorious picture we're about to do is, can you talk to us and just on where we're at now? So I know this is talking about things that we've done, but this month and things to come, how can people in the community step up and help? How can businesses get involved? And how, because this is a community effort, it's not just a city effort, and this is all of us together trying to help our community.
That's a great question, Shane Piccinini, for the record. First and foremost is when you know people that need food assistance, please direct them our way. During the last 18 months, we've seen families come to an emergency food assistance pantry or through one of our direct services that had never used it before, never had a need to use it before. And, they didn't want to. There was a certain stigma to that, and we want to take that away. So first and foremost, if you know somebody that needs food assistance, have them come and find us, and we will help them. That is what we're here for. Secondly, because it is Hunger Action Month, we're asking that if anybody would like to do a food drive for us, we will shamelessly accept that. Because, you know, as the holiday season approaches, we need to make sure that we've got a fully stocked pantry for our 150 partner agencies to be able to make sure that there's a resource there. And to give you some context, right now we're serving probably around 100,000 people a month. Just keep in mind that this number has been fluctuating week over week, but we're just going to average it out to about 100,000 people every single month. And our service area is 90,000 square miles. We have got a deep reach that goes all the way out to rural Nevada, Tonopah, to the borders of Utah and Idaho, and then we serve the areas of California that are currently on fire. So there is a huge need, and one of the zip codes in the city of Sparks that has been the highest need is the 89431 zip code. So we are actively doing what we can to make sure that people within that community and that zip code area are getting the resources that we need. Does that help?
Any other questions from the council? Okay, thank you. We're going to take your picture real quick for posterity purposes. This is usually where you drop your pencil.
Yeah, she's crawling under
Thank you. Okay, 7.3, smoke-free Truckee Meadows. Come on down. Good afternoon, ladies.
Hi.
When you start, will you please state your name for the record, please?
Yes, for the record, I'm Christine Thompson with Nevada Cancer Coalition.
And I'm Nicole Alberti with Washoe County Health District.
You?
And is it this, or do I need to use the, okay, thank you. So, good afternoon, Mayor Lawson and City Council. We've introduced ourselves already. I'll just add that I am the Prevention Programs Manager at Nevada Cancer Coalition, and my colleague Nicole at the Washoe County Health District is Health Educator Coordinator there. We both also are board members of the Nevada Tobacco Prevention Coalition. Thank you so much for this opportunity to be here today to talk to you about an important health equity issue. Nearly 40,000 hospitality employees in our broad community all across the Truckee Meadows are chronically exposed to secondhand smoke and vape fumes at work. We've already heard a lot already today about the impact of the global pandemic, and certainly those people who work in places where who are exposed to secondhand smoke exposure also have been impacted by the global pandemic. This pandemic targets the human respiratory system, and it also has had a disproportionate impact on people of color and low-wage earners, and it is time to end this disparity. It's time to clear the air. In Nevada, the leading causes of death are heart disease, lung cancer, and chronic lower respiratory diseases. All these illnesses are associated with smoking and secondhand smoke exposure. Nevada Tobacco Prevention Coalition's local initiative, Smoke-Free Truckee Meadows, which we are here today representing, is working to help ensure comprehensive clean indoor air in Reno, Sparks, and Washoe County. Local jurisdictions under the Nevada Clean Indoor Air Act have been expressly given authority to enact stricter regulations around smoke-free workplaces. Our community is uniquely ready and strategically positioned for this change.
As a native Nevadan, I distinctly remember when people still smoked in restaurants, grocery stores, and other workplaces, leading to employees and patrons having to breathe in the secondhand smoke. In 2006, Nevada voters passed the Nevada Clean Indoor Air Act, a statewide ballot prohibiting smoking in most indoor public places, including most workplaces. This has provided the majority of residents in the Truckee Meadows the opportunity to work and play in healthier and safer smoke-free environments than they did 15 years ago. However, there are still exemptions from the law, including casinos and bars. We still have many fellow Nevadans who do not get this protection. So why smoke-free now for the Truckee Meadows? It's time. Our region is much different than it was in 2006, with a more diversified economy and a focus on the healthy and vibrant opportunities our local businesses, events, and outdoor activities provide. Over 85% of residents and visitors do not smoke, and people want smoke-free and air where they work and play. And it's no secret that secondhand smoke causes adverse health effects to non-smokers who are exposed. What a lot of people don't realize, however, is that ventilation systems cannot actually remove the toxins in the air associated with secondhand smoke. And of course, as we've talked about COVID protections are minimized when smoking is allowed. For those of us who are not in a smoking environment regularly, the recent air quality due to wildfires was a stark reminder of what many of our family members, friends, and neighbors experience at work. Back in 2013, a research team at the University of Nevada, Reno conducted a study comparing the air quality of a beautiful, clear day in the Truckee Meadows to the air quality experienced during wildfires, and at that time it was the RIM and American fires, to the indoor air of local casinos that allow smoking. Specifically, they measured small particles in the air called PM 2.5. You've probably heard a lot about that with all the wildfires. And they posed the greatest health risk as they lodged deep inside the lungs. The result was that there was a very little difference between the air outside during wildfires and the air inside of a casino. This slide is just a reminder that secondhand smoke in workplaces can adversely impact the health of employees. For instance, non-smokers exposed to secondhand smoke at work increase their risk of developing heart disease by 25 to 30%. In this short presentation today, we won't be doing a deep dive into the chronic diseases that can arise due to secondhand smoke exposure. We do, however, want to share a quote from Northern Nevada Medical Center pulmonologist Dr. Aline Serrani, which says, "It's relatively common to see folks coming in suffering from pulmonary diseases, respiratory issues, lung nodules, cancers, and they've never smoked. The only identifiable risk factor is working decades in a closed environment being exposed to secondhand smoke." COVID is a respiratory disease, so it's no surprise that smoking, vaping, and secondhand smoke exposure has led to underlying conditions that result in more severe disease or death from COVID-19. Because of this, leading public health experts recommend that communities immediately strengthen secondhand smoke exposure policies. Additionally, removal of masks in public settings to smoke or vape increases the risk of COVID-19 exposure from smokers' exhalations if infected with the virus. It's the heavy exhalations. According to the American Society of Heating, Refrigerating, and Air Conditioning Engineers, also known as ASHRAE, there's no currently available or reasonably anticipated ventilation or air cleaning system that can adequately control or significantly reduce the health risks of environmental tobacco smoke to an acceptable level. So even if you can't initially see or smell the secondhand smoke, the toxins are still present. This is why non-smokers who work in this environment where they're exposed to secondhand smoke are still getting sick. Further, ASHRAE goes on to confirm that the only way to protect employees and the public from secondhand smoke are 100% smoke-free policies. Please note that the Northern Nevada chapter of ASHRAE has joined more than 24 other businesses and organizations in support of the Smoke-Free Truckee Meadows initiative. Over 70% of adults in the U.S. who smoke want to quit. Smoke-free workplaces encourage employees who smoke and vape to quit or to reduce consumption. Smoke-free workplace policies increase cessation rates among these employees by 6.4% and decrease smoking and vaping prevalence by 3.4%. So who's left behind in the smoke? It's very noticeable that lower income groups and minorities are most impacted by the current exemptions in the Nevada Clean Indoor Air Act. Many are non-smokers, yet experience adverse health outcomes related to regular secondhand smoke exposure in the work environment. And often these are the employees that have less access to medical care and treatment. Health Health equity is when everyone has the opportunity to be healthy as possible. No one should have to choose between clean air and a paycheck. Yet we know that over 30,000 people in the Truckee Meadows do that regularly. Tobacco use and secondhand smoke exposure in public places is a health equity and social justice issue. Very often, these employees do not perceive that they can leave a job even if they're worried about their health. Allowing smoking in casinos and bars creates inequitable conditions that lead to these health disparities. Laws that allow smoking indoors favors corporations and business owners and disadvantage local citizen employees. Fortunately, local governments have the power to change this and ensure equitable and healthy workplace environments. So why don't we just let businesses choose? They have that option under the current law. And that's what we're doing now, and it's not working. Public health experts across the board agree that uniform policy is the best and only way to provide equitable protection for everyone.
I doubt there's anyone in this room who disputes the terrible toll that commercial tobacco use has had on our nation's citizens. Tobacco and secondhand smoke exposure kills nearly 500,000 people every year, more than AIDS, alcohol, car accidents, illegal drugs, murders, and suicides combined. Even so, as people have become better informed about tobacco harms, tobacco use has dramatically declined. However, facing these declines, the tobacco industry has relentlessly pushed back, spending billions of dollars to keep and gain new customers and inventing new products that are even more addicting. Vaping is among those. There are a number of myths that are presented by the tobacco industry, and these myths are also shared by some in the hospitality industry. Among them are that gambling, smoking, and drinking go together, that not allowing smoking will reduce gaming revenue, that ventilation systems offer protection, that small businesses and bars will lose business, and that people always have a choice in where they work. These are myths. This is not true. The reality is that customers prefer smoke-free venues. Most hospitality employees want this change, even though they cannot speak, most of them cannot speak publicly for fear of retaliation. Employees often don't have a choice to leave. And another reality is that there is business to gain. You might ask, given the recent record revenue room tax that our community has been celebrating, the reports that came out about July room tax, well, why should we make this change given people are coming here, we're seeing record revenue? Well, that's true. But keep in mind, this is COVID times. We've seen lots of news reports and have had these conversations. People are desperate to get out from under COVID confinement. And how many of them, I would ask, are coming here and are just putting up with it, as do many of us who go into these places. We put up with it because we really don't have a choice. We have to be in a location for business. And again, our visitors just come here because they want to come and experience all that our great community has to offer, the wonderful amenities, the festivals, the outdoor recreation, and so they put up with it. Please know, we are not discounting the impact that gaming in particular and hospitality in general contributes to our community or to the amount of community partnership that our gaming industry contributes. But on this issue of continuing to allow smoking in their venues, we disagree. The reality is that smoke-free workplaces add up to success. Smoke-free casinos and bars do thrive economically. In places like Pennsylvania, Maryland, and Ohio, smoke-free gaming properties are setting revenue records. Casinos in Atlantic City, while operating smoke-free, had 11% higher revenue than in the best pre-COVID month. In Reno, a gaming executive reports to us that the machines in his smoke-free room outperform identical machines in smoking rooms. Bars, clubs, dance halls, and casinos in destination cities like Austin, Texas, and Atlanta and New Orleans are thriving after passing local smoke-free laws. And the economic success extends not only to the business owners, but to the employees who work there and to the community at large as people become healthier and as healthcare costs decline. A study shows that Washoe County will save $49 million every year in healthcare costs when smoke-free workplaces become reality in the Truckee Meadows. A silver lining, if you will, of the pandemic is that many more hospitality venues are smoke-free. All across America, nearly half of all states, 1,638 municipalities, more than 160 tribal gaming properties, and nearly 1,100 casinos do not permit smoking indoors. These decisions reflect not only COVID-related public health considerations, but also opinion research that routinely shows most guests, smokers included, prefer smoke-free indoor casinos and bars. Because of the pandemic, casinos have learned how to do business differently, and Indian gaming is leading the way. Even before the pandemic, there were a number of tribal properties that were operating smoke-free. A smoke-free environment was shown to be the second most important reason when choosing where to gamble, only behind location. And this was reported during a July meeting of the National Indian Gaming Association in Las Vegas. They stated that the fallacy we operated with was that people weren't going to come back if smoking was banned. But in fact, that did not prove to be true at all. They noted that employee retention had improved and that their health insurance costs had decreased. Smoke-free workplaces add up to success, and some of our local operators in the Truckee Meadows are examples of this. Monarch Casino Resort in smoke-free Colorado, owned by Atlantis and the Greater Monarch Casino and Resort Group, has recently completed a $400 million expansion. And in smoke-free New Orleans, Caesars Entertainment has invested $325 million to transform Harrah's New Orleans into Caesars New Orleans, which is also completely smoke-free. In addition, they have invested $138 million over 20 years to own the naming rights to the smoke-free New Orleans Superdome. In April this year, New Orleans Mayor LaToya Cantrell, who helped lead passage of a smoke-free ordinance when she was a city councilor, was quoted as saying, "All the things we were told would happen, that our hospitality industry would suffer. 6 years later, none of that has materialized. Our hospitality industry grew even stronger, with an upward of 19 million visitors to the city of New Orleans. We stood up for the people who work in restaurants and bars and casinos. People shouldn't have to die to earn an honest living." We've done some studies ourselves, and in the Truckee Meadows, a community attitude survey showed that 60% of people favor prohibiting smoking in all Washoe County casinos, 63% favor prohibiting smoking in all Washoe County bars, and among non-smokers, this number goes up to even higher, to 74%. Other local studies are also pointing to this trend. In all of those, the people also note that they would be both more likely to visit a casino and bar and would find them more enjoyable if they were 100% smoke-free. We also went throughout our community and measured the number of gamblers who were actively smoking. 77% of active gamblers in Washoe County casinos, this was in March of 2019, are non-smokers. Here in the Nugget, here in Sparks, in the Nugget, 80% of active gamblers are non-smokers. Again, a very substantial majority. National surveys also show that poker players greatly prefer smoke-free environments. Let's go green. Nicole mentioned earlier our supporters, and they include local, state, regional, and national partners among them. And I'll point out on this second slide, Northern Nevada Health System, again, another of Spark's prominent employers here. The University of Nevada, Reno was an early supporter of our effort. Former President Mark Johnson recorded a video for us, and President Brian Sandoval has also done so. In the interest of time, I won't play that video here, but I encourage you, if you have not yet done so, to go to smokefreetruckymeadows.org and listen for yourself. Sparks, we're here today hoping that this presentation has shed some new light and given some new perspective on the glaring health disparities faced by those who work in locations where smoking is still allowed. And that with this information about the health and business successes that will come with smoke-free policies, that you will join us as advocates for this change. This body, as does every local jurisdiction in Nevada, has the authority to enact stricter smoke-free policies than those laid out in state law. There is no question that region-wide policy is needed. And we're here today noting that in the same way that the 3 jurisdictions work together to implement smoke-free policies in our city and regional parks, with Sparks leading the way, and with many thanks to Councilmember Don Abbott and former Parks and Rec Commissioner or Director Tracy Dominguez, we and many others believe that it's time for our jurisdictions to work together to implement smoke-free indoor air policies. We know that we are asking you to do a hard thing and take a position that many in the local industry will oppose. There will be claims that their businesses will suffer. The influence of the hospitality industry casts a long shadow in Sparks and Reno and Washoe County. But our local economy, even here in Sparks, throughout the region, is no longer driven solely by gaming. We are so much more diverse, and we've shared information about how smoke-free policies are operating very successfully. In an article titled The Reno Recovery, published in a recent issue of Global Gaming Business Magazine, EDON's Mike Kazmersky was quoted. "Gaming is still a very important but declining part of our economy," he said. "It's gone from the cake and frosting to just the frosting. It no longer drives our ability to be economically stable. We believe, and diverse data supports us in this, that smoke-free policies will be the sprinkles on this metaphorical frosting. We have so much going for us here in the Truckee Meadows. This council, together with the other jurisdictions, works hard to improve the quality of life for our citizens. Our region's hospitality employees deserve to have the same clean indoor air protections that the rest of us enjoy. We hope you will join us and lead the way in working with the other jurisdictions to begin the process of ensuring smoke-free workplaces so that no hospitality employee is left behind in the smoke any longer. Thank you so much for this opportunity to be here today. And if you have any questions, we'll do our best to answer them. I don't know if I can go back here.
Questions? Mr. Anderson?
I want to thank you for the presentation and what you guys are working on. It's a tough project, but I appreciate what you guys are doing. You had a lot of data showing everything from the number of individuals that are exposed to it, all kinds of data. One I didn't see was what we would see locally by removing smoking from the casinos. I didn't see anything that said we're going to see an uptick, that it's actually going to get better instead of worse. Do you have anything like that?
We received a grant almost 3.5 years ago from Renown Health Foundation to look at this. And as part of that, we commissioned an economic study. The College of Business, Department of Economics at UNR commissioned a study for us. And what they told us is it is almost impossible to put a fine point number on it. They gave us scenarios. They do expect, and it has been shown elsewhere, and as you saw in that slide on Indian gaming, that there would be some initial downturn in revenue, but that very quickly, and Indian gaming indicated that within less than a year, revenue came roaring back and that it eclipsed what there was previously. But the economists can't tell us. We don't know. We just don't know. Very likely there would be some downturn, but looking again all across other places where this change has happened, revenues would return and improve.
And I guess my concern is that equity portion that you're talking about. And I agree completely that those people are the ones that can least afford health issues, least afford problems with jobs. And that's actually my concern. If you own a casino and I own a casino and you go smoke-free and it's a success, I would do the same thing, or vice versa, right? I mean, so that's where I've got a concern, thinking the people that are owning and running these casinos are smart people. And they have to be seeing the numbers that are reflecting something different. So now, if indeed you go and mandate smoke-free and people do drop and go to other places, those same people that were fighting for equity are now out of work. And that is, I think, a whole new issue that we would be facing in our community. And the only other thing that I had with that is on the voluntary side, what are you seeing that isn't working as far as the voluntary side of the casinos dropping it?
It's not, we're not asking that this be voluntary. We are recommending that this be region-wide, every jurisdiction that it is required across the board, so that no one is losing business to their neighbor who has chosen to go smoke-free. We do have examples here in our community of bars who have gone smoke-free. In Las Vegas, the Park MGM is currently smoke-free, but we do not have any true casinos here. The Golden and Silver in Reno opted to go smoke-free and is still operating smoke-free. But
no, and I understand what your drive is. I guess what I'm saying is if it's going to work, I believe the marketplace will adjust accordingly. That if smoke-free is a success for one location, like the Gold and Silver, then all the casinos are going to start jumping on that. And again, I'm concerned that if we mandate, like what you're asking for, that we're going to see a huge side effect of that mandate. And that's just my thought. So thank you.
When we've met with casino executives behind closed doors, one of their concerns, they're nervous, obviously, about it, and they would be nervous to be the first ones, they've told us. They would be a little, the larger ones are a little bit more open to if it was across the board, because they feel like they might be impacted less.
Mr. Adams.
Thank you, Mr. Mayor. Yeah, when you talk about ordinances, I'm the guy that pretty much has to draft those up. I was interested, as Councilman Anderson was, concerning your data and the false narrative being perpetuated by the pro-smoking industry. How does that data, as it relates to secondhand smoke and all the cancers and the disadvantages associated with that, apply to marijuana smoking and marijuana lounges and those kinds of things?
So the research is a little it's less evolved with marijuana, as it is federally illegal and a little harder to research than tobacco. There is evidence that there is cardiac issues associated more with marijuana smoke than even, or secondhand marijuana smoke than even secondhand tobacco smoke. So I mean, having these conversations while we're also in the process of moving forward with cannabis lounges and cannabis events is definitely a tricky one, but the research isn't as solid with marijuana as it is with tobacco. We have decades worth of research related to secondhand smoke and
So
tobacco.
if we were to enact some ordinances that related to smoke of either both tobacco and marijuana, we could count on your support to limit that.
Oh,
For both of them.
Is that correct?
To limit, yes. So
And
I don't know,
Wait a minute.
I don't know if we understood your question. I'm sorry.
so if we were to enact an ordinance that applied not only to the hospitality industry, but in order to avoid equal protection arguments and, you know, all those things that lawyers like to bring up, we applied it to all the businesses. And we applied it to both tobacco and marijuana smoking because of all the dangers attendant there too. We could count on your support in those types of an ordinance, correct?
I think definitely from us and from the public health perspective, again, I know that the regulations from the Cannabis Compliance Board are still being worked on for those things, so I don't know exactly how they intersect, but philosophically, we absolutely are concerns about the cannabis secondhand smoke as well.
Wonderful. Thank you very much. Thank you again, Mr. Mayor.
Okay. Anyone else wishing to speak? Okay, thank you, ladies. Appreciate it.
so much.
All right, let's move on to consent items. Anyone wishing to take a consent item? If not, I'm looking for a motion. Mr. Anderson?
Move to approve consent items 8.1 through 8.5.
Okay, Mr. Dare?
Second.
Any further discussion? Seeing none, please vote.
Aye.
Thank you. Motion carries unanimously. Moving on to item 9.1, consideration, discussion of possible acceptance of a Federal Emergency Management Agency Assistant to Firefighters Grant for $52,928.21. Don't forget the 21 cents. To provide an emergency medical services program with equipment and paramedic school tuition with matching funds of $4,811.66. Chief Reed.
Good afternoon, Mr. Mayor and Council. I am Jim Reed, your fire chief. And I am here today to try and keep up with the police department and seek your approval for this federal grant. It's already been allocated for us, and like I said, you said the amount of $52,928.21.
21 cents. Don't
21
forget that.
cents.
That's important.
So the FEMA grant is a 90% federally funded and 10% match through City of Sparks funds, which is already budgeted in our fiscal 22 fire department budget. And like you said, $30,000 of that would be for paramedic tuition to send our either current or our future employees to school to be paramedic certified. And then the remaining funds would be used for CPR mannequins. And that concludes my request, and I'm here to answer any questions. And if there's anything specific, I do have a captain, EMS captain here with me, Jeff Sullivan, and he can help me if needed.
Questions from the council?
Yes.
Mr. Dare.
What does it cost to send one to, you said that's $30,000 towards helping with that. How far will that reach? What is that? Is that?
We're
send two
hoping for
people?
4.
4.
It kind of depends if we go with the REMSA program or TMCC. There's a little bit of flexibility in how many people sign up and what that total cost is. When we applied for the grant, we estimated about $10,000 per.
Perfect. Thank you. Good job.
And how many hours is paramedic training now? Just round numbers?
48 every month.
No.
Thank you. Hello, Mr. Mayor, members of City Council, Jeff Sullivan, EMS training captain for the record. The training levels for every 2 years for the paramedics is roughly 40 to 48 hours.
But what's the total for the school?
What do you?
About 1,000?
Yeah.
Oh, yeah, roughly,
1,000
because they
hours.
have school time, clinical time, didactic field time, so it's a pretty long process.
Okay.
Usually about a year.
10,000 seems pretty high for 48 hours, but
Sorry, I thought we were talking certifications.
I want that job,
Sorry
is what I'm
about
saying.
that.
Okay. All right, any questions from the council? All right, seeing none, I'm looking for a motion. Ms. Vanderwell.
Thank you, Mr. Mayor. I move to accept the Federal Emergency Management Agency Assistance to Firefighters Grant for $52,928.21 to provide the Emergency Medical Services Program with equipment and paramedic school tuition with matching funds of $4,811.66.
Ms. Bybee.
I'd like to second that motion and thank you. We always like to accept grants and federal money coming for something so important to your, to the city and to paramedics in this community. Thank you.
Any further discussion? Seeing none, please vote.
Aye.
All right, motion carries unanimously. Thanks, Chief.
Thank you.
Consideration, discussion, and possible, item 9.2, consideration, discussion, and possible acceptance of the coronavirus response and relief supplemental appropriation stipend grant for Nevada's Child Care and Development Program and the Children's Cabinet in the amount of $58,000 for reimbursement of Small Wonders staff payroll. Mr. Pele.
Mr. Mayor, City Council, Tony Pele, Acting Director for Parks and Rec Department. To try and keep up with the fire department, I have a grant for your consideration.
Keep bringing that free money. We like it.
That's it. From the Coronavirus Response and Relief Supplemental Appropriations in the amount of $58,000. The stipend grant is being distributed by the Nevada Child Care and Development Program and the Children's Cabinet. This will help defray our preschool costs, wages from July 1st of this year to December 31st of this year. We currently operate 2 preschools, and COVID had a severe impact on the child care industry, and these stipends were created to help stabilize the industry. Usually government agencies aren't eligible for these grants, but they extended an invitation to us in early June because they had some leftover money, so we were glad to apply. There are no matching funds, but I wanted to bring this to you since it was over $50,000, and I'd be happy to answer any questions.
Questions from the council? See any questions? So I'm looking for a motion. Mr. Dare.
Sure. I move to accept the Coronavirus Response and Relief Supplemental Appropriation Stipend Grant from Nevada's Child Care and Development Program and the Children's Cabinet in the amount of $58,000 for reimbursement of Small Wonders staff payroll. Good job.
Ms. Bybee?
Thank you, Mr. Mayor. I second the motion and thank you because the child care is critically important, always, but even more so now. So thank you. I appreciate this.
Okay. Any further discussion? Seeing none, please vote.
Aye.
Okay, motion carries unanimously. Thank you, sir.
Thank you.
All right, consideration, discussion, and possible approval of a construction contract AC 5804 with Express Sewer and Drain for the sanitary sewer cured in place pipe project.
Is this a grant?
This is not a grant.
Unfortunately, it is
See, you
not.
broke tradition here, young man.
Unfortunately.
Next time.
PWP, hashtag WA-2021-356, in the amount of $508,717.00.
Thank you, Mayor Lawson and members of the council. For the record, Kevin Porter, Utility Manager. And this construction contract is for our Cured in Place Pipe Sewer Rehab Program. The acronym that we use is CIPP for this rehabilitation method. And this is something that we spent some time during the council workshop discussing why we're so excited about this technology and beginning to use this as potentially an annual or biannual sewer rehabilitation method. As you can see on the exhibit on the screen, we're focused on, for this year's, which is going to be the fiscal year 21 budget, we're focused on the area, kind of our older area in Sparks. This is inside the McCarran Loop. On the screen on the bottom, you'll see Prater Way. Towards the top, you'll see Audie Boulevard. And then off to the right of the screen, you'll see Pyramid Way, and then Rock Boulevard off to the left. And what we find inside the McCarran Loop in our older neighborhoods in Sparks are sewer systems that are coming up to the age of 50 years, 60 years, maybe even more. A lot of those are reinforced concrete pipe, and inside the interior of that pipe, there's a lot of degradation on the surface wall, not only from 60 years or more of repeated sewer flowing across that surface, but also because of the gases that are released inside a sewer system and what that does to concrete. And so what is CIPP? What we're asking you for some money for today, it is essentially, it begins as a felt liner. I brought some props for show and tell. This is not show and smell, as Mr. Drinkwater would like to do at the plant.
Thank goodness.
This is a felt liner that is inserted longitudinally into the sewer pipe, and then it is inflated with an air bladder so that it fits well into the circular surface of the pipe. And then ultimately, this is cured. We use steam. Some jurisdictions may use hot water. Some are moving to UV. Our spec currently uses steam. What that liner ultimately becomes is the clear section on the inside of this blue PVC pipe. And so if you can imagine this blue PVC were an old concrete pipe with very rough inside, aggregate falling out, what you would end up with is this clear section on the middle inside the pipe that is ultimately very similar to what this blue piece is, which is plastic polyvinyl chloride PVC pipe. It's structural. It's not just for looks per se, or it's not just to improve a small section. It's a structural section of the pipe. And that's why we're really excited for it from a staff perspective, is that it essentially extends the life of the pipe that's in the ground. We're comfortable with saying for 30 years at a cost that is 10 to 20% of what a full pipe replacement would be. Certainly, we don't need to cut into the street, do a full open pit excavation for this type of work, and that really helps to drive to keep that cost down. The way that we find the sewer pipe sections inside the city that we would like to do this rehabilitation method with is by using the data that is collected by our public works sewer crew, the van that they operate, the CCTV van, and then ultimately the condition assessment data that they produce with that van. That helps guide us using data. Using the data helps drive us to the areas of the city that this rehabilitation method is appropriate for. And so with that, this, as I mentioned earlier, this project is actually using fiscal year 21, last year's budget money. We will be bringing another round of this forward in fiscal year 22. This was approved with the fiscal year 21 CIP. And we are anticipating that what you see on the screen here accounts for approximately 1.5 miles of 8-inch diameter sewer. And as Mayor Lawson mentioned, the cost of this project is right around $509,000. The low bidder was Express Sewer and Drain. They're out of Sacramento. And with that, staff recommends approval. I'd be happy to answer any questions.
Questions from the council? Councilman Dare.
Yes, I want to say, just from the time you guys brought this, I think this is a great use of new technology, of something that's great for us. I do want to throw out there again something I think I've said a few times, so just continue. I think there's a wisdom in us looking at this as a yearly thing. It's going to save us all money in the long run and be fantastic. One question I do have, so the people who live right there, as you work on their sewage, do they not get to flush their toilet for a week? How does that work?
There is a short period of time. It's much less than a week. It's usually a matter of hours, call it 2 to 4 hours. Okay. And they are noticed with door hangers, and then also some signage that's put up in the neighborhood. And so it is a very short duration time period, and the notification process is certainly meant to bring that to those homeowners' attention prior to the contractor actually trying to do that the day of.
Thank you.
Absolutely.
Ms. Bybee.
Thank you, Mr. Mayor. I'm super excited because it just makes so much sense fiscally, but timeline, the timeline on it too. So you said that you don't cut the street. Do you access through the manholes
That's
to actually do this work? And then how long do you anticipate? I mean, each section would be a few hours per section?
That's absolutely correct, Councilmember Bybee. It's, the liner is inserted through a manhole, and then they have the capability, if we're doing a section, say that is potentially 1,000 feet, that would normally encompass 2 to 3 manholes. They're able to run that all the way through that 1,000-foot section. And then they go back after the liner is cured and then can cut out that section that's in the other manholes. They can also then go back and cut out the openings to where a house, residential or business structure's lateral penetrates into the side of that pipe. And so that process does take time, but the initial process, when we're on a specific street, I'm actually gonna call in a friend for help. I'll let him introduce himself. This is the project manager for our CIPP.
Good afternoon, Mr. Mayor, members of council. Ashley Elson, Senior Civil Engineer, for the record. Sorry, repeat the question one more time?
Would you provide, Ashley, what the timing is for when the contractor spends inserting the bladder until it's cured on one section?
Oh, so the cure time, I believe, is right around 60 minutes for the steam. And that's inflated through that 1,000-foot section. There's an inverted bladder that actually pushes the epoxy-coated sock through the liner, or through the existing pipe. They steam that, it sets up and cures, and that actually, when it cures, it creates a little indent into the laterals, and they can come back and cut those laterals real quick, and then they come back and they lift the manholes, and they get down there and they cut the top of that liner out of the manhole so that they can access it for future needs.
Wow. I mean, pretty amazing. So, yeah, the technology is amazing. And then you said, Kevin, that our assessment that led you to knowing which pipes is the investment we made this last year on the CCTV, the camera that goes down and looks and does inspections of our whole system without sending so many people down, and you have better data, better access because of those cameras, correct?
That's one reason why the staff, we're both engineers, we were so excited about this, is because we don't wait for a pipe to fail and someone to call in and say our sewer's plugged or the street fell into a pipe. We're able to use the data that our public works crews are collecting and go out and be proactive in attacking areas around town and hoping certainly to mitigate that issue of a pipe failing by beefing up these pipes structurally. And like we said, the intent is at least 30 years or more.
So we can, just as a follow-up, if you don't mind, Mr. Mayor, this is the initial phase of what we plan to do, and we will be continually looking, gathering more data to decide subsequent pipes throughout the city. When they reach that point where they would need that, we would do, hopefully, in the future. I know this is just for this section today, but you are anticipating we will be doing this throughout the city eventually?
Correct, yeah. So our sewer crews, our public works crews are continually monitoring, taking video for pipes, making the assessments, and then that data gets downloaded, and then we're able to score each pipe segment, make a judgment call on the condition of it and whether it falls into the category to then use a liner rehab or some other traditional method of repairing that infrastructure.
Okay, thanks so much. Super exciting.
So how do you handle tree roots and whatnot? I live in the inner part of McCarran, and tree roots in the sewer is pretty normal occurrence.
That's an excellent question, Mayor Lawson. And this technology actually assists in when we do see those issues of roots growing in through joints in pipe or breaks in pipe or sewer laterals. We kind of attack that from two ways. Mr. Corman's on the public works side, the sewer crew under Mr. Corman, they are actively with one of our vans that is actually one of the camera vans. They are actively trying to work the root areas. What they'll do is they go in with a machine that cuts all those roots back, and then they go in with a chemical that's safe to use in the sewer that is meant to limit the growth or kill those roots at that point. doesn't always work. We certainly see the roots come back year after year. Why we are excited about this technology is that we don't see those same type of root issues in PVC pipe. And so once again, with that final product that we end up with on the inside of the pipe, it would be much more resistant to the roots working themselves into the pipe than our older pipe that has the voids and the means for the roots to find their way in.
Still fascinating to me. This is amazing. That's good stuff, and especially at 10 to 20 cents on the dollar. And if I'm correct too, a lot of our old Sparks, those sewer lines run through the backyards. So you literally have to take someone's yard, several people's yards out. Yeah, this is a great solution. Okay, any other comments from the council?
I just have one.
Mr. Dare.
You guys have done an amazing job and get us all very excited about sewage. So
Exactly.
I give you a hand. I never
Yeah.
thought I would. Thank you.
Yeah, where's Casey at on a day like today? Casey's this has got to be great for him. All right, I'm looking for a motion. Mr. Anderson.
I move to approve construction contract AC 5804 with Express Sewer and Drain for the sanitary sewer cured in place pipe project, PWP WA 2021-356, in the amount of $508,717. And I want to say thank you, even though it's not as nice as money on a grant. Great job. Thank you.
And Ms. Bybee.
I'll second that motion.
Okay, any further discussion? See none?
Okay, real quick, Mayor Lawson.
Yes, go ahead, Mr. Abbott.
I just gotta ask for a ride along when the time comes. It's cool technology, and excited to see it happening in my ward, like you said, Lawson. That a lot of them in the backyard, they're old pipes that we're getting some love. They're good price. They're good work.
Thank you.
Okay, so Mr. Corman, Donald has to go look at all the shiny new toys.
Yes, sir.
All right, I have a motion and a second. Any further discussion? Seeing none, please vote.
Aye.
Motion carries unanimously. Thank you, Kevin. You're going to be up for the next one?
Yes, Mr. Mayor.
Consideration, discussion, and possible approval of a design services contract AC 5806 with Atkins for the North Truckee Drain Alternatives Analysis and Engineering Design in the amount of $399,025. Mr. Porter.
Thank you, Mayor Lawson. Once again, Kevin Porter, Utility Manager for the record. This project is a professional services contract with Atkins Engineering for not only engineering design, but also some alternatives analysis. And what the scope of this contract is to evaluate the North Truckee Drain in the vicinity of north of the interchange with Interstate 80 and Sparks Boulevard up to approximately Prater Way. And that's what you'll see on this exhibit. Down at the bottom is the water park. Legends is on the left side of the blue line, and Sparks Boulevard runs right down the middle, north and south. Prater Way is at the top. And really what's driving the timing for this project and the need to do this now is that, as council's well aware of, the Regional Transportation Commission is in design for the widening of Sparks Boulevard in this vicinity as well as farther north. And that widening will certainly impact and be adjacent to the North Truckee Drain in the vicinity of Sparks Boulevard. The city is aware of some flooding concerns and some known flood breakouts in the 100-year modeling on the North Truckee Drain that occur in this stretch. And so what we would like to do is to work through that design, that modeling, that alternatives analysis to understand truly what end alternative, what end configuration for the North Truckee Drain will not only mitigate those flood concern issues, but also some known access issues for our public works crews to be able to maintain this stretch of the North Truckee Drain, as well as for it to operate functionally as well as it should for being at the end of the day, being a flood control feature or asset for the city. And so we don't know at this time whether that means an enclosed box culvert like what is on the south side of I-80 and the North Truckee Drain, or potentially some channel modifications, potentially a rectangular channel as opposed to the current V ditch that we see. But we do know that working through having the modeling done that Atkins will do, we'll be able to determine not only a good design from a flood control standpoint, but also, once again, from a maintenance access and operational, functionally operational standpoint. And so what the scope includes that alternative consideration modeling, and then it ultimately does include the final design so that we get the construction drawings and what we need to be able to put this project out to bid, whether we do that solely from the city's perspective, or if we try to include that with the RTC's work through an interlocal agreement, we would have that option at the end of the design. The fee for this, as Mayor Lawson mentioned, is just over $399,000. It was approved in the fiscal year 22 CIP. Staff recommends approval, and I'd be happy to answer any questions.
Questions from the council? Mr. Dare.
So looking at this, I'm just wondering where the bank comes from. Is this just because CIP, is it just out of the general? Is this something that we've done? I know we have a regional flood thing. I mean, is this just something because we know what needs to get done, we just as a city are taking it on?
Would you repeat the first part of that question, Councilman Dare? I didn't hear the first part of that.
I'm just wondering, sometimes we have finances in the bank that people have helped pay for these kind of flood mitigation type things. Is this finances come right out of there? Is that out of the general? Or is it a regional, part of the regional flood bank of what we do?
Well, to answer your question, Councilman Dare, this project is funded through the city's river flood fee that is assessed on the citizens throughout Sparks. That fee is ultimately collected and lives inside our storm drain fund. So it is a Sparks storm drain project funded through that river flood fee. And then I'd also like to add, just for context on how we scope and how we understand that need exists for this project. It's kind of a combination of factors, but as you're well aware of, the city does own and keep up to date a storm drain master plan that helps identify these types of needs where we see these 100-year flood impacts that certainly get on the list of being addressed through a CIP project.
So some constituents ask me sometimes about these funds that go in there. I thought that I wanted to make sure this is when I can say, here's what I can point to it and say, hey, this is where your money's going. This is why, in that kind of setting. So that's exactly. Thank you.
Absolutely. Thank you.
Mr. Anderson.
So one, I want to say thank you for having a component in there where the public can actually get involved in this and make some comments, because obviously there are a lot of businesses and residents that enjoy that trail, as well as businesses that are concerned about it flowing over. I do have a question though on the north side of it, since they're going to be widening further up the Truckee, the North Truckee Drain. Are we not concerned about that at that point, or how is that going to play in?
We absolutely are concerned, certainly across the whole stretch of the North Truckee Drain. The reason we're taking such a specific and concentrated approach at this stretch is mainly because those known flood concerns exist in that 100-year event. And so that's why the city is taking that action on this stretch of the drain for the design, as opposed to that falling on the RTC because they're impacting the North Truckee Drain. And so to answer your question fully, Councilman Anderson, is we are already in works with the RTC and their designer, who is also Atkins Engineering, on what the impacts will be north of Prater Way, all the way up to Bering, where the widening will end, and ensuring that we address any maintenance access issues that exist there, or any issues with potentially dead trees that are now a flood concern, that types of thing. So the issues along the drain north of Prater Way don't necessarily relate to the known flooding issues, and that's why this piece is just from Prater down to the water park.
Thank you.
Thank you.
Ms. Bybee.
Thank you, Mr. Mayor. Kevin, so you talked about working with RTC because of the widening of Sparks Boulevard, and it absolutely makes sense that if we had both projects going, that we do them at the same time. If you're affecting traffic and digging up a road or everything around it. It happens simultaneously. Are we going to be able, because this is just for the design phase, and it sounds like RTC is in their design phase as well, will you be able to hopefully coordinate so that construction that will happen can happen together or as close together as we can with RTC? I would guess that's your goal.
Yes, Councilmember Bybee, certainly our two concerns at this point are the impact to the traveling public that would occur from this work as well as the RTC's work, as well as any efficiency or cost savings that we can realize by either doing the work separately or combining it with the RTC. And so those would be the two factors that would drive us to attempt to get an interlocal agreement approved to include that work with the RTC, or if the data and the reasoning is justified to do the work separately. But the one thing we do know at this point is we don't want to have that road widened, have all the landscaping redone on both sides, and then bring another contractor in after the fact and disturb that stretch for work on the North Truckee Drain.
Mayor, thank you. On Paul's question, there's just a little more to that. So if we go into RCC and they determine that they are not going to want to work on this, we anticipate potentially something come back to us then that we can, because I would say this, if that's going to be open, whatever end result we need to get to, it seems very wise that we are prepared, whether it's RTC or us or whoever, to make sure that we're doing whatever in that road needs to be done.
Certainly.
Are we saying the same thing?
Absolutely,
Okay.
and I understand your concern, Councilman Darren. I'll say that the RTC is a very good partner for the city to work with, as you're well aware of, and there is not at this time a concern that they will not help us with some of those smaller issues like the maintenance access or some spot-specific issues for drainage improvements along that stretch. The real reason being on this stretch that we're so attacking this is that flooding issue, the channel modifications that will be somehow, that will ultimately mitigate that flood breakout during that 100-year, that won't be on the RTC's shoulders because they already exist now. And they certainly, the RTC will help us do some improvements to the channel, but not to the standpoint where we make large modifications such as this to address those large flood breakout
I
issues.
totally get what you're saying. That makes 100% sense. But I would say, as we open that up and we're looking at things, it would be really wise. I mean, I say this because as a region, I'm not saying that they're a great partner. RTC always has been, but it doesn't mean they're always going to think, they may not always do it to the level we think needs to be done. And I would ask that if there's something that we think needs to be at a certain level when that's open, that it comes back and we at least get a conversation. It doesn't just get closed up because RTC did or didn't want to do something.
Absolutely.
Thank you.
Okay, Ms. Bybee?
On a follow-up to that, I'm a little confused now. On a follow-up to that, we are going to do it regardless, and that's why this section has to do with the flooding, the 100-year flood, and that's the city of Sparks and North Truckee Drain. So regardless of what RTC does or doesn't do, whether we have an interlocal, we are still going to be moving forward with design and with action for that section of the drain, regardless, with or without whatever RTC is doing, correct?
That's absolutely correct.
Okay.
It's a known issue, and we've got the funding from our river flood fee to address the issue. The real issue that we're working through now is the timing of that.
Okay.
We want to be able to have the answer to this project and the design complete to be ahead of or at the same time of the RTC project. If they, for some reason, were to say, we're not doing the Sparks Boulevard widening, or hold off or delay, we would still move forward with this project because of the known flood control issues.
Okay, thank you for the clarification. I appreciate it.
Just to put your mind at ease too, they usually come to me sitting on that board and let us know what's going on. So it's not a secret. They're not doing it in private. Okay, so with that then, any other questions from the council? I am looking for a motion. Mr. Anderson.
Move to approve the design services contract AC 5806 with Atkins for the North Truckee Drain alternatives analysis and engineering design in the amount of $399,025.
Mr. Dare.
Second.
Got a motion and a second. Any further discussion? Seeing none, please vote.
Aye.
Motion carries unanimously. Thank you very much. All right, on to item 9.5, consideration, discussion, and possible approval of an expenditure up to $841,400 for contract labor for park, streets, drains, fleet maintenance, facility maintenance, and public works administration during FY '22, utilizing a joinder provision with the state of Nevada contract. Mr. Corman.
Thank you, Mayor Lawson, members of the council, Ron Corman, your Public Works Maintenance Manager. I'm the goat today because I'm just asking to spend money, I guess, but. So before you today, we're looking for your approval for an expenditure for $841,400 to spend on contract labor for the fiscal year '22. This request is to supplement the work that is done by our maintenance crews out in the city. We have earmarked of that $841,400. We've earmarked $505,700 for contract labor for parks maintenance. This provides for 7 year-round contract labor positions performing the following tasks: operating trash truck, the community service van when is in operation, 1 for full-time weed abatement, 2 to help with irrigation in the summer and weed spraying and tree trimming in the winter, 1 assigned to the trash truck working with the sheriff's work crew, 1 to clean downtown area in the marina, 8 additional seasonal contract labor positions during the summer to perform the following tasks: 3 assigned to the mow crew, 1 to operate an additional trash truck, 1 to cover the trash truck day off, 2 to assist in maintaining the small parks, and 1 to assist with special projects. That also includes $135,000 for street maintenance. This provides for 3 year-round contract labor positions performing the following tasks of crack sealing, street patching, filling potholes, cleaning alleys, etc. $74,400 would be for drains maintenance to augment the weed abatement and the open ditch cleaning around the city. $46,700 would be for facility maintenance to assist in some of the remedial tasks like boiler room cleaning, HVAC filter changing, light bulbs, unclogging toilets, etc. And $29,000 for fleet maintenance, and this provides for a utility maintenance worker, trash pickup, shop cleaning, that kind of thing, parts pickup. And last, $50,600 for maintenance administration. This provides for a year-round data entry person for keeping up on our documentation of the work performed by the maintenance group. This year, I'm asking for some latitude. I'm sure you may have noticed that in the title, we do not have listed in there any one particular vendor. It's because at this time, we're having difficulty finding contract laborers anywhere. And so to try and expand our resource ability, I'm asking for your latitude to allow me to hire from, if we can find them, from the 3 agencies that are currently under contract with the state of Nevada to provide temporary labor services. Those companies are Acro Service Corporation with the Nevada State contract of 99 SWC-NV21-7575. Manpower Temporary Services, their contract number is 99 SWC-NV21-7577. And Marathon Staffing Group, Inc., their contract number is 99 SWC-NV21-7576. As I mentioned, we will be utilizing the joinder provision to hire any staff on this contract, and this has been budgeted in the fiscal year '22 budget for the different areas that I'd mentioned before of maintenance. With that, I'd be happy to answer any questions.
Question from the council. Ms. Bybee.
Thank you, Mr. Mayor. Ron, I just had one question in here. It mentioned the sheriff's work crews. Are the work crews back up again, and do we have the ability to, or will we be working with them again, or is that when and if? Because we have in the past.
Councilwoman Bybee, thank you for your question. To answer your question, we are anticipating that the sheriff crew will come back at some point. The sheriff's office is still trying to hire in and fill the positions on their side before they can bring them over to us. So we are, in anticipation that when that happens, that we'll be able to pull the trigger on our side to be able to ramp up our operation.
Okay, and when that comes to us, we do a separate agreement with the sheriff's work crew, comes
Yes, ma'am.
before us, like it always does. I just noticed that you mentioned this labor working with them, so was just curious the status.
Yes, ma'am, I would
Thank
be
you.
before you when the sheriff office says that they can accommodate us, then we have budget set aside for that cooperation with the sheriff's office, and I would be before you to seek your approval in beginning that again.
Perfect, thank you so much.
Thank you.
Okay, any other questions from the council? Seeing none, I'm looking for a motion. Mr. Dare.
I move to approve an expenditure of up to $841,400 for contract labor for parks, streets, drains, fleet maintenance, facility maintenance, and public works administration during FY '22, utilizing a joint provision with a state of Nevada contract.
Ms. Vanderwell.
Second.
I have a motion and a second. Any further discussion? Seeing none, please vote.
Aye.
And motion carries unanimously. Thank you,
very
Ron.
much.
Okay, moving on. We have no public hearing and we have no planning and zoning. So that goes back to comments from the public. Do we have anyone wishing to speak at this time under public comment? Seeing none, we'll bring it back to the dais. And announcements from the mayor, city council, and city manager. Do we have any? Are you sure?
I have one.
I knew you would. You can.
Well, this is one I know that affects us all. This last weekend, I got to be with a lot of our veterans. They did a whole muck run where they took the tags of every person who died in 9/11 and then walked with them for about 12 miles. And it was just a real special time. But obviously, one of the things that I just say at large for our community, for Sparks, we can never forget those things, but hopefully we learn from those things. So it's not just something that we remember and say, look what happened. But we obviously have a pretty amazing country, an amazing city, and our first responders and our veterans we're so thankful for. So anyway, just out loud, wanted to say we recognize that and remember that and encourage people to take a time to make sure our kids realize what that even means. Thank you, Mayor.
Ms. Bybee?
Just because I can't let him go without me saying something too, you know that. I would just like to thank everyone who helped. Last Thursday, we had staff, we went to the hospital, Northern Nevada Medical Center. We were part of a regional effort to thank our frontline medical workers. So every hospital in the region, through a really quick effort, Julie and the communication directors from Washoe County, Reno, Sparks, working together to go to the hospitals and just thank our nurses and doctors and staff at the hospitals who are pretty overwhelmed right now. And it was a very random act of kindness that I think was so well appreciated. I wanted to personally thank the council who was there, our city manager, assistant city manager, our fire and police, and there were a lot of, Chief Reed, a lot of your representation was there, a lot of your firefighters, we had police there, and then at the other hospitals, you saw, I was on social media, some of the other, Pause for Love, the dogs were there, and I think it just was really, it happened quickly, but I think it was really appreciated. And that day, one of the supervisors said to me, she said, your timing could not have been better. She said, yesterday we felt like we were running a MASH unit. That's how rough it was here at the hospital. So us showing up and giving them donuts and flowers meant a lot. And I think at the end of the day, just continuing to thank those who are serving medical community, first responders, all of us still trying to get through this. And through the helping our community is important. And I think on that note, really remembering all of us to be kind. And we have a kindness challenge out there. So it's a kindness challenge Sparks and a kindness challenge Reno. To just remember, we forget to be kind. In these really rough times, we're just not remembering. We just take a moment to anyone, whether it's first responder, or teacher, or someone in your life, a neighbor, to just some acts of kindness to help us all get through this. And I think that goes a long way and says a lot about our community. But thank you all who were involved last week.
Anyone else? Okay. Well, then we're on to my favorite topic, adjournment. For the good of the order, we are adjourned.